The second grade story for the week is A Trip to the Emergency Room. This is real world reading because it's a nonfiction article that gives information about real people, things, or events that happen. Comprehension strategy is to summarize, because we're going to work on sequencing, which is the order that things happen, like first, next, and then. Oh no! You have a broken bone. Where do you go? To the hospital emergency room, of course. The emergency room can be a busy place. Ambulances and people arrive there during the day and night. People are brought there if they have a serious medical condition, medical problem. Doctors and nurses work in the emergency room. Their job is to help people who are sick or hurt. Other people work there too. They help keep the hospital running properly. Let's meet some of the people who work in a hospital emergency room. An admissions worker. The first person you see in the emergency room is an admissions worker. The hospital needs to keep track of the patients coming into the emergency room. The admissions person checks you in. The adult who is with you will fill out hospital forms. The forms ask for your personal information and why you came to the hospital. Nurses and aides. Next, a nurse will help you. A nurse's job is to find out about your injury and ask you questions about your health. The nurse will take your temperature and blood pressure and record this information on a chart. The nurse informs other people in the hospital about your problem. Then you will meet an orderly or nurse's aide. That person will help you get around in the hospital. She will take you to the correct department if you need to get tests done. She may use a wheelchair to take you from one area to another. A doctor. Last, it's time for the doctor to examine you. The doctor checks your injury. He also looks at your chart. He arranges for you to get an x-ray if you need one. The doctor knows how to fix your broken bone. He will probably put on a cast so the bone will heal. The doctor also decides whether you need to stay in the hospital or if you can go home right away. So don't worry if you need to go to the emergency room. Now you know about the people who work there and how they will help you feel better. A visit to the dentist. You need your teeth to eat. To take good care of them, eat healthful foods and remember to brush and floss every day. It's also important to visit the dentist every 6 months. Here's what happens at a dental checkup. First, the dentist takes x-rays. These pictures of your teeth show if you have any cavities. They also show the health of your teeth and gums. Next, the dentist or an assistant cleans your teeth and makes them shine. Last, the dentist looks carefully inside your mouth. He or she uses a little mirror to see the teeth in the back of your mouth. The dentist is pleased when your teeth and gums are healthy. In 6 months, it will be time to come back for another checkup.